Is your joint red, swollen, and painful? So painful that even a bedsheet hurts? You might have gout. Let's break it down and figure out what's really going on. Hello, this is Dr. Siddharth Amber from Chicago Arthritis and Regenerative Medicine. I specialize in non-surgical treatments for musculoskeletal conditions, rheumatology, regenerative medicine, and metabolic health. My goal is to help you live pain-free and optimize your health with cutting-edge treatments. Today we're talking about how to know if you have gout, one of the most painful types of arthritis, and often one of the most misunderstood. If you've ever had a sudden attack of intense pain in your big toe, ankle, or knee, especially at nighttime, you may have wondered, could this be gout? In this video, I'll walk you through the signs, symptoms, and tests we use to diagnose gout. I'll also bust some myths and help you understand what steps to take next if you think you're dealing with a gout flare. So what is gout? Gout is a type of inflammatory arthritis. It happens when uric acid builds up in your body and forms sharp crystals in your joints. These crystals trigger a strong immune reaction, which causes swelling, redness, and severe pain. Think of uric acid crystals like tiny needles inside your joint. That's why it hurts so much. Gout attacks are often sudden and dramatic. One day you feel fine, the next you're in agony. It often wakes people up in the middle of the night as well. Let's talk more about what gout usually feels and looks like. Sudden, intense joint pain, often in the big toe, but it can also hit other joints, including ankles, knees, or fingers. Redness and swelling. The joint looks angry and feels warm to the touch. Tenderness, even to light touch, like a bed sheet or sock, can feel unbearable. Limited movement. You can't move the joint much without pain. One joint at a time. Especially early on, gout frequently affects one joint at a time. Long term, it can affect multiple joints at the same time. And some people can also get tophi, lumps of crystals under the skin filled with uric acid crystals. If the gout has been going on for a long time and has not been treated, you can see these sort of tophi develop. So what causes gout? Uric acid is a normal waste product your body makes when it breaks down substances called purines. These are found in foods like red meat, seafood, and alcohol. Normally, uric acid dissolves in your blood and is removed by your kidneys. But in some people, the body makes too much uric acid, or the kidneys don't remove enough of it. That causes uric acid levels to rise and crystals to form. Risk factors for gout include genetics, if you have a family history of gout, if you eat a lot of meat, in particular red meat, or drink too much alcohol. Obesity or metabolic syndrome is also associated with gout. High blood pressure or kidney disease can also make you more prone to gout. And certain medications like water diuretics that will make you a little bit more dehydrated and make gout more likely to develop. So how do you know if you really have gout? Here's where it gets important. Gout is a clinical diagnosis, meaning we rely on your symptoms, medical history, and tests to make a diagnosis. Let's break this down into three categories. The gold standard test is synovial fluid crystal analysis. This is the most accurate test. We take a small amount of fluid from the painful joint using a needle. That fluid is examined under a microscope to look for uric acid crystals. If we see crystals, you have gout. End of story. The pros are this is an extremely accurate way to make a diagnosis. The cons are that it's not always easy to do during a flare-up. Some doctors may not have the right tools or training to properly aspirate the fluid from your joint. Next are imaging tests. If joint fluid testing is not possible, we can use imaging. Ultrasound is always a favorite of mine. This can show uric acid crystal buildup and joint inflammation. The crystal buildup you'll see sometimes on ultrasound, but the joint inflammation you should pretty reliably see. This is helpful in experienced hands when it comes to using ultrasound. Next, there's dual energy CT scan or a DECT scan. It's a special type of CT scan that can actually detect uric acid crystals. It's very accurate, but not always widely available. These tests help us see the crystals when we cannot actually draw the fluid. And then lastly, there's your uric acid blood levels. A lot of people think a high uric acid level means that you definitely have gout, but that's not always true. Here's the truth. If your uric acid is over 10 and you have classic gout symptoms, that's highly suspicious. But you can have a normal uric acid level during a gout flare. And you can have high uric acid without symptoms, called asymptomatic hyperuricemia. So we typically don't diagnose gout strictly based on your uric acid levels in the blood. They're just part of the puzzle. Let's clear up a few common myths about gout. Only old people get gout. That is not true. I see people in their 30s and 40s, in particular young men, with gout, especially if they have metabolic issues. Another misconception, if it feels better after a few days, it's likely not gout. That's not accurate. Gout attacks can go away on their own in 7 to 10 days, but they typically come back if they're not treated. And if my uric acid level is normal, it cannot be gout. Again, that's not true. You can have normal levels, falsely normal levels during an attack. The key is symptoms and possibly fluid or imaging tests to make your firm diagnosis. So when should you see a doctor? If you've had more than one episode of intense joint pain that came on suddenly and got better in a few days, that's a red flag. If the pain is so bad you can't walk or sleep, or if the joint looks red and swollen, you should get checked out. And if you've been told it's just inflammation without a real diagnosis, don't settle for that. Ask if it could be gout itself. What happens if you don't treat gout? Ignoring gout is not a good idea. Over time, repeated attacks can damage your joints permanently. They can lead to tophi, hard crystal clumps under the skin. They can lead to chronic joint inflammation, and they increase your risk for kidney stones and kidney disease. That's why early diagnosis and treatment matter. So how do we treat gout here at Chicago Arthritis? Once we know you have gout firmly, treatment is personalized for you. It usually includes, for flare-ups, anti-inflammatory medication, ice and rest, short-term prescription meds like colchicine or anti-inflammatory medications. If needed, joint fluid aspiration and a steroid injection into the joint or short-term oral steroids can be very helpful short-term if the inflammation is severe. For long-term prevention, there's a number of things. Lifestyle changes are key. You want to make sure you're doing the right thing from a diet standpoint, which means reducing your amount of red meat, shellfish, and alcohol. You want to make sure you're staying hydrated, and you want to make sure that you're trying to get to an optimal weight level. Again, the reason why is that there does seem to be this connection between metabolic syndrome and obesity with gout as well. Medications like allopurinol or febuxostat, also known as Uloric, are used to lower your uric acid level more significantly, put that into a normal range so that you don't have additional flare-ups. And then addressing root causes like metabolic syndrome. I try to take a whole body approach to gout because it's not just about the joint, it's about your overall health and inflammation as well. So let's recap. Gout is a painful inflammatory arthritis caused by uric acid crystals. It usually hits suddenly, often at night, and causes intense pain and swelling. The best way to diagnose gout is by finding crystals in joint fluid, but imaging and high uric acid blood levels can help too. Do not ignore repeated flares. Gout can lead to long-term joint and kidney problems if left untreated. The good news, gout is treatable and you can live pain-free with the right treatment plan. If you found this helpful, please make sure to like, subscribe, and check out our website at chicagoarthritis.com for more expert advice on staying pain-free and healthy. If you're in Chicago and you think you may have gout or just want a smarter non-surgical approach to joint pain, contact us to schedule a consultation. See you next time and live well.